Today, on Skin Secrets, a worried mom brings in her 9-month-old with a strange growing rash, and she fears the worst.
Hi, I'm Dr. Jen, and who's this little cutie?
Hi, this is Sophia. She woke up with a red patch near her patch in her hair. I'm worried, doctor.
I can see why you're concerned. Come on in.
I see. I can see why you're concerned. So this actually looks like Tinea corporis, also known as ringworm. But don't worry, it is very common and very treatable in babies.
When I heard ringworm, I thought worms. I started Googling it in my head, but the doctor seemed very calm, so that assured me.
So ringworm is actually just a skin infection. So it is actually from a group of fungi. It's called, this is very hard to say, trichophyton. Okay, so babies can get it from anywhere, like pets, carpets, daycare, toys, basically from everywhere.
But is it serious?
So not when we treat it early. And since this is only in the skin and it's very mild infection, so we can actually just treat it with the topical antifungal cream. And then actually, I have this cream right here. It's called clotrimazole. Clotrimazole is safe and gentle, and it's perfect for babies with small patches of tinea. And parents love it because you can start to see improvements just within a week. So this clotrimazole cream, you're gonna apply a thin layer on a little bit beyond the edges of the rash, and then you're gonna do it for about 2 weeks. And then even if it starts to get better, it looks like it completely went away a little bit sooner, just please make sure that you do apply it during those full 2 weeks, okay?
Okay, are there any precautions I should know?
So good question. Since this is a topical cream, it is very safe and the precautions are quite simple. So just don't apply it on broken skin. If the skin it's getting worse, like you don't see it improving, you get irritated, just discontinue it. And then also avoid getting it in the eyes.
Are there any side effects? I'm so scared of giving her something harmful.
So topical clotrimazole rarely causes any problems. Maybe just a little redness or some mild stinging. The oral version of clotrimazole are actually lozenges, and that one can have some side effects. For example, GI tract or abdominal pain, nausea, diarrhea, and it's even reported to cause some elevated liver enzymes. So those serious side effects that you might be concerned or you might see online, they're actually associated with the oral clotrimazole that comes in lozenges, but that one, we never give those to babies. Like those higher concentrations or oral formulations, we don't use those to treat ringworm. We use this, the 1% topical cream. This one is very safe and it has a really, really good track record.
Okay, I can breathe now. When I heard the doctor say that the serious side effects don't apply to my baby, I think I almost cried. I just want to do everything right for my baby.
You're doing an amazing job, Mama, okay? So just start the cream today, apply the thin layer like I instructed you to do so. Keep the area dry and clean, and then we'll check in 2 weeks, okay? I'm sure that Sophia's gonna be just fine.
Thank you to Dr. Jen. Now I can go home in peace, knowing that my baby is going to be fine.
A scary rash, a relieved mom, and another tiny patient on the road to healthy skin. Don't miss next week's episode of Skin Secrets.